Greetings, outside agitators, and greetings to the 98% of us who are from North Carolina. I'm Dr. Jonathan Koch. I'm a pediatrician specializing in maternal and child health. My message today is simple. Children are different. Because they are powerless, they're dependent upon powerful adults to protect them. This legislature and this governor have abandoned our children. Children will suffer the most from their cold-hearted, calculated retreat from the modest environmental protections for which we have fought. Children are different. They're closer to the ground. They're closer to herbicides and pesticides on the floor and in the soil. They inhale higher concentrations of air pollution. Their organs and immune systems are immature and are therefore more sensitive to chemicals. And for the first couple of years, they put everything in their mouths. We know that many chronic child health conditions are increasing in frequency, and it is no coincidence that this increase has accompanied the increasing number of chemicals to which our children are exposed. In fact, those exposures begin in the womb. For this reason, it is wrong to take poor pregnant women who need access to prenatal care off Medicaid. It is wrong. It is wrong to defund the Child Fatality Task Force, which has contributed to saving the lives of 10,000 children since its inception in 1991. It is wrong to cut Smart Start by 40% when we know it supports children's health and school readiness. Let me be clear. The health of the next generation of North Carolina's working adults will depend upon the health of our children today. Chemicals are everywhere, yet there is no law that says that chemicals have to be shown to be safe before they can be introduced into the environment. It's not good enough to wait until children's lives are harmed by asthma, allergies, autism, attention deficit, hyperactivity, obesity, and diabetes before taking the offending chemical off the market. This is not the time. This is not the time to relax the regulation of smokestack emissions. This is not the time to let communities upstream from our water supply off the regulatory hook. Children need more protection. Children need better protection. Children need effective protection from chemicals in the air, in water, in food, and in soil, and they need it now. Thank you.
My name is Wes Wallace. I'm an emergency physician. Now, when most of you think about emergency physicians, you think about someone who spends the most of their time treating car wrecks, gunshot wounds, heart attacks. But let me tell you, in the last few years, my practice has changed dramatically. I spend now a significant part of my time treating desperate people who have come to the emergency department because they have no funds to access the healthcare system. Emergency departments are the one place that won't say no.
Right.
My practice is about to get even more dramatically different because of the legislators' failure to extend Medicaid to 500,000 people in North Carolina. What we're going to see is increasing numbers of people coming to emergency departments, and they're going to be sick. They have waited so long in desperation that by the time they see me, they are sick unto death. And unfortunately, a lot of them don't make it. By the time the pregnant mother comes to see me, she's already in great risk of losing her baby. The people of North Carolina deserved better. Healthcare in this country should not be seen as a privilege for the privileged. It should be seen as a right for all of us. My prescription for you today is that we continue forward together. Forward until we have a healthcare system and a Medicaid system that this state can be proud of.